Heart failure, your emergency action plan, what to do and what to carry. Living with heart failure means managing your condition diligently, but it also means being prepared for unexpected emergencies. Knowing the signs of a crisis and having a clear action plan can significantly improve outcomes and even save lives. This article outlines key emergency events for heart failure patients, what steps to take, and what, if any, medications you should carry for immediate use, always in consultation with your doctor. The foundation, your personalized heart failure action plan. Before diving into specific emergencies, it's crucial to understand that every heart failure patient should work with their healthcare team to develop a personalized heart failure action plan. This plan typically categorizes your symptoms into zones, often green for stable, yellow for caution, and red for emergency, and provides clear instructions on how to respond. This article focuses on the red zone, emergencies, and what to do while professional help is on the way. Critical emergency events for heart failure patients. Heart failure patients are at risk for several types of emergencies, each requiring a specific response. 1. Acute decompensated heart failure, worsening fluid overload/pump failure. This is the most common emergency for heart failure patients and signifies that your heart's ability to pump effectively has acutely declined, often leading to fluid buildup. Signs and symptoms. Rapidly worsening shortness of breath, especially at rest, when lying flat, orthopnea, or waking up gasping for air, paroxysmal nocturnal dyspnea. Sudden, significant weight gain, often 2 to 3 pounds overnight or 5 pounds in a week, indicating fluid retention. Increased swelling, in your legs, ankles, feet, or abdomen. Persistent, hacking cough, sometimes producing pink, frothy sputum. Severe fatigue or weakness, out of proportion to usual. Increased discomfort in the lower body due to swelling. What to do while waiting for the ambulance. Call 911 immediately if symptoms are severe. Call 911 or your local emergency number. Explain you have heart failure and your symptoms are rapidly worsening, particularly severe shortness of breath. Sit upright. Help the person sit upright, perhaps leaning slightly forward, to ease breathing. Avoid lying flat. Loosen clothing. Loosen any tight clothing around the neck and chest. Stay calm. Reassure the person. Anxiety can worsen shortness of breath. Monitor breathing. Observe their breathing rate and effort. Do not give food or drink, choking risk. Gather information. Have a list of current medications, allergies, and medical history ready for paramedics. Medications to carry for emergency use. Diuretics, water pills, if prescribed and instructed by your doctor, for patients whose doctors have specifically given them an as-needed plan, an extra dose of their prescribed loop diuretic, e.g., furosemide/Lasix, bumetanide/Bumex, torsemide/Demodex, can be taken to help remove excess fluid rapidly. This must be a pre-discussed and prescribed part of your individualized action plan. Do not self-adjust diuretic doses without clear instructions from your healthcare provider. 2. Acute ischemic event, heart attack/acute coronary syndrome. This refers to a sudden blockage of blood flow to the heart muscle, often due to a blood clot in a narrowed coronary artery. Heart failure patients, especially those with underlying coronary artery disease, are at higher risk. Signs and symptoms. Severe chest pain, often described as pressure, squeezing, fullness, or pain, which may spread to the shoulders, neck, arms, especially left, jaw, or back. Shortness of breath, can occur with or without chest pain. Cold sweats. Nausea or vomiting. Lightheadedness or sudden dizziness. Unusual fatigue, especially in women, this can be a more subtle sign. What to do while waiting for the ambulance? Call 911 immediately. Call 911 or your local emergency number immediately. State that you suspect a heart attack. Time is crucial for saving heart muscle. Stay calm and rest. Help the person sit or lie down comfortably. Avoid any strenuous activity. Loosen clothing. Loosen any tight clothing around the neck. Do not give food or drink. Gather information. Have a list of current medications, allergies, and medical history ready. Medications to carry for emergency use. Aspirin, 160 to 325 milligrams, non-enteric coated, IF instructed by a 911 dispatcher. If a heart attack is strongly suspected, and you have non-enteric coated aspirin available, a 911 dispatcher might instruct you to chew and swallow one aspirin. Chewing helps it absorb faster. Crucially, do not take aspirin unless instructed, as it can be harmful if the symptoms are due to a bleeding event, like a hemorrhagic stroke, or other conditions. This is a highly specific action for suspected heart attack only. 3. Serious arrhythmias, irregular heart rhythms. Heart failure can lead to or worsen dangerous heart rhythms, which can severely compromise the heart's pumping ability. Signs and symptoms. Sudden onset of very fast or very slow heart rate. Palpitations, feeling a fluttering, pounding, or racing heart. Dizziness or lightheadedness. Syncope, fainting or near fainting. Severe shortness of breath or chest pain. Sudden weakness or confusion. Patients with implantable cardioverter defibrillators, ICDs. These devices may deliver an internal shock to restore normal rhythm. Do not interfere with the device. If the person receives more than one shock, loses consciousness, or does not improve after the shock, call 911 immediately. What to do while waiting for the ambulance? Call 911 immediately. Call 911 or your local emergency number. Explain that the person is experiencing a severe change in heart rhythm or has fainted. Help the person lie down. This prevents injury if they faint. Check for breathing and pulse. If the person becomes unconscious and isn't breathing normally or has no pulse, begin CPR immediately. The 911 dispatcher can guide you through hands-only CPR. Loosen clothing. Stay calm and reassure. Medications to carry for emergency use. None for self-administration. Serious arrhythmias require immediate medical assessment, often with an ECG and advanced medical intervention. Patients with implanted cardioverter defibrillators, ICDs, may receive an internal shock from their device, but this is an automated response, not a medication carried. 4. Stroke, ischemic or hemorrhagic. A stroke occurs when blood flow to the brain is interrupted, ischemic, or a blood vessel in the brain ruptures, hemorrhagic. Heart failure, particularly with atrial fibrillation, significantly increases stroke risk. Signs and symptoms. Think of AST. F. Face drooping. Ask the person to smile. Does one side of the face droop? A. Arm weakness. Ask the person to raise both arms. Does one arm drift downward? S. Speech difficulty. Ask the person to repeat a simple sentence. Is their speech slurred or strange? T. Time to call 911. If you notice any of these signs, even if they are subtle or go away, call 911 immediately. Other symptoms: sudden numbness/weakness on one side of the body, sudden confusion, sudden vision problems, sudden severe headache, thunderclap, headache for hemorrhagic. What to do while waiting for the ambulance? Call 911 immediately. Call 911 or your local emergency number immediately. State that you suspect a stroke. Note the time symptoms started, or the last time the person was seen normal. This is critical for treatment options. Help the person lie down safely. Position them on their side with head slightly elevated if conscious. If unconscious but breathing, place them in the recovery position. If the person is conscious and vomiting, keeping them sitting slightly upright can help reduce aspiration risk. Do not give anything to eat or drink, risk of choking or aspiration. Do not give any medications, especially aspirin. You don't know if it's an ischemic or hemorrhagic stroke, and aspirin would be harmful in a hemorrhagic stroke. Stay calm and reassure. The person may be confused or frightened. Gather information, have medical history, medication list, and emergency contacts ready. Medications to carry for emergency use. None for self-administration. Rapid diagnosis and professional medical intervention are paramount. 5. Severe internal bleeding. While not exclusive to heart failure, patients on blood thinners, common for heart failure with AFib or previous clots, are at increased risk. Signs and symptoms, often indicating hypovolemic shock due to blood loss. Significant drop in blood pressure, hypotension. Rapid heart rate, tachycardia. Rapid, shallow breathing. Pale, cool, clammy/sweaty skin. Dizziness, lightheadedness, confusion, extreme weakness, or loss of consciousness. Extreme thirst. Localized pain/swelling, e.g., severe abdominal pain, abdominal distension. Visible signs of internal bleeding from orifices, bloody vomit, bright red or coffee grounds, black tarry stools, melena, bright red blood in stool, blood in urine, coughing up blood, unexplained severe bruising. Patients on blood thinners, such as warfarin, apixaban, rivaroxaban, are at higher risk of internal bleeding. These medications interfere with the blood's ability to clot. What to do while waiting for the ambulance? Call 911 immediately. Call 911 or your local emergency number immediately. State that you suspect severe internal bleeding. Help the person lie down, keep them warm with a blanket. Elevate legs, if possible, and no suspected head/neck injury. This can help return blood to vital organs. Do not give anything to eat or drink. Do not give any medications, especially aspirin or other blood thinners. These would worsen the bleeding. Gather information, have medical history, medication list, especially blood thinners, and emergency contacts ready. Medications to carry for emergency use. None for self-administration. Severe bleeding requires immediate hospital intervention to locate and stop the bleeding. In some cases, hospitals may administer specific reversal agents for blood thinners, e.g., vitamin K, and dexanet alpha, or idarosizumab, but these are not for home use and must be managed by professionals. General emergency preparedness for heart failure patients. Medical identification. Always wear a medical alert bracelet or carry a card detailing your heart failure, medications, and allergies. Medication list. Keep an up-to-date list of all your medications, name, dose, frequency, easily accessible. Consider a digital copy on your phone or in a vial of life. Emergency contacts. Have a list of emergency contacts readily available. Educate loved ones. Ensure family members or caregivers know your action plan, how to recognize symptoms, and what to do in an emergency. Doctor's contact. Keep your cardiologist's and primary care doctor's contact information handy. Know your baseline. Regular self-monitoring, daily weight checks, blood pressure, symptom diary, helps you and your doctor recognize when something is truly abnormal. Doctor-written instructions for emergency medications. While carrying specific emergency medications is limited to a few well-defined scenarios, primarily diuretics for fluid overload and aspirin for suspected heart attack under guidance, the safe and effective use of any emergency medication depends on clear, personalized medical instruction. It is strongly recommended that your doctor provide written instructions for every medication you may carry for emergency use. This helps ensure safe, appropriate use based on your specific health status. Guidance for caregivers and emergency responders. Avoidance of harmful drug interactions or misuse. Each medication should have a brief note or instruction card, ideally signed by your provider, that explains when to take the medication, the proper dosage and form, when not to take it, any follow-up steps. These notes should be kept with your emergency kit, wallet, or medical alert documents, and reviewed annually or after any medication change. While carrying specific emergency medications is limited to very few, well-defined scenarios, primarily diuretics for fluid overload and aspirin for suspected heart attack under guidance, the most powerful tool in any heart failure emergency is rapid recognition of symptoms and immediate activation of emergency medical services, calling 911. Always discuss your personalized emergency plan and any carry medications with your healthcare provider. Conclusion: empowering yourself through preparedness. Living with heart failure is a journey that demands vigilance, knowledge, and a strong partnership with your healthcare team. This guide has illuminated the critical, red zone, emergency events, detailing the immediate actions you should take and clarifying the limited instances where specific medications might be carried for urgent use, always under strict medical guidance. Your personalized heart failure action plan is more than just a document, it's your blueprint for safety, empowering you to recognize warning signs and respond effectively. While the immediate call to 911 for severe symptoms remains paramount, understanding what to do while help is on the way can significantly impact outcomes. Ultimately, managing heart failure emergencies comes down to proactive preparedness. By educating yourself and your loved ones, maintaining an up-to-date medication list, and regularly discussing your emergency plan with your doctor, you're not just reacting to a crisis, you're actively taking control of your health. Embrace this active role. It's the most powerful step you can take toward a more secure and confident life with heart failure.